Hello, I'm Dr. Greg Malone from the Brisbane Urology Clinic for our third and final instalment of Trending in Urology. Today I'll be discussing the penile prosthesis or penile implant, which has been in use for over 40 years and has helped over 300,000 men return to an active, satisfying sex life. 1 in 5 men over the age of 40 suffer from erectile dysfunction. Yet ED remains a fairly taboo subject, with many men choosing to suffer in silence. These men will often give a history of common medical conditions such as heart disease, diabetes and hypertension. Or they may have undergone therapy for prostate cancer, often at a younger age, say in their 40s, 50s or 60s. This produces a dramatic and negative quality of life impact on the patient and their partner. When ED medication such as sildenafil and penile injection therapy is not the answer, there are other effective surgical options that can provide a satisfying outcome. One excellent solution that I offer is the penile prosthesis or penile implant, which has been in clinical use for over 40 years and has helped over 300,000 men return to an active, satisfying sex life. Many patients and partners are highly satisfied with the penile implant, but like any surgical procedure, there are both benefits and risks to be considered, which I discussed thoroughly with all of my patients. A penile implant is entirely concealed within the body. It is designed to be simple and discreet to operate and does not interfere with orgasm or ejaculation if that is preserved. In a study comparing ED treatment options, patients reported a 93% satisfaction rate with penile implants. This far surpasses satisfaction rates for other treatment options when you consider that one of the penile prostheses on the market has 92% of patients and 96% of their partners reporting sexual activity with the implant to be satisfactory or excellent. Of course, a surgical solution like a penile implant generally is not the first course of action, but deserves serious consideration for men who suffer from ED. For most patients, the benefits of ED medication cannot be understated. But for those who cannot benefit from these medications or those who suffer from the side effects, a penile prosthesis should be considered as a permanent, satisfying alternative for them. There are many reasons why I offer my patients a penile implant. Firstly, it is extremely convenient and provides the ability to have an erection anytime your patient chooses, allowing them greater spontaneity in having sex when the mood strikes and having it feel natural during intercourse. Another key patient benefit is that the penile implant enables our patients to maintain an erection as long as they desire and does not interfere with a man's orgasm or ejaculation. It's because of all these patient benefits that I've chosen to use penile implants in my practice. The most commonly utilised penile implant is the 3-piece inflatable prosthesis. This features a pair of cylinders which go into the penis, a pump which goes into the scrotum, and a reservoir which sits in the lower abdomen. All of these components are completely concealed and very discreet. When the fluid is pumped into the cylinders, it creates an erection that provides rigidity and girth expansion. All in all, the penile implant should be an important consideration in your ED discussions with your patients. Please feel free to contact me if you'd like more information about penile implants or any other urological condition that you feel is relevant to your patient care. Thank you for your time, and I look forward to future opportunities for us to work together for the betterment of all of our patients.